So looking at the context of education in Wales and in the other countries of the United Kingdom, and indeed many other countries, these are dark times. They're dark times because we see shortages of staff, shortages of head teachers, shortages of deputy head teachers, and that puts huge pressure on everybody. We're seeing, of course, very high levels of stress and burnout. It's difficult to get a really precise indication of how high those levels are, but we know in general that stress and burnout levels are amongst teachers, and those working in schools are amongst the highest, if not the highest, in the economy as a whole, exceeding even levels of stress amongst healthcare workers. That probably indicates that, on average, more than 1 in 2 staff are feeling burned out at work, either often or all of the time. And I think we throw these words like burnout and stress around without really understanding what they mean. In human terms, chronic burnout, and it generally tends to be chronic in these contexts rather than episodic or transient. Chronic burnout is associated with illness, cardiovascular disease, addictions, alcoholism, cancers, diabetes, depression, and outside of health, with family breakup. It is also associated with having a real impact upon our ability to make decisions. So I think our first response must be a response of compassion and understanding, both self-compassion and compassion for those we lead. We also see in our society huge inequalities in general. Inequalities, I was just looking at the data before coming here on head teacher representativeness, the representativeness of head teachers in secondary schools and primary schools, and looking at the gender distribution, and it is extraordinary. 2/3 in secondary school are men, 1/3 of men in primary schools. And there's some really, I think, profound questions about that disproportionate representation. And we see huge inequalities in health outcomes in our society, whether it's to do with people from minority ethnic groups or people with disabilities. They are extraordinary, and also huge inequalities in outcomes in terms of the socioeconomic group you're part of. For example, if you take Scotland and you compare the richest and poorest areas of Scotland, on average, men in the poorest areas live to 48 years of age. In the richest areas, they live to 72 years of age. Another health inequality, if you're a woman from black minority ethnic group background, you're something like 6 times more likely to die in or around childbirth compared with the white majority. We can go on. You'll be well aware of the general trends. This is not a basis for a cohesive, inclusive, integrated, happy society. So it's an important issue, but also to address within our own professions. Given the challenges that we face as societies, as communities across the United Kingdom, what we also need is transformation. This is not about tinkering with the deck chairs. This is about the need for fundamental transformation as a society. How do we create the conditions where every individual in our country can be as happy as they can possibly be? Whether it's a 3-year-old child feeling safe, feeling loved, feeling excited and curious about this amazing world, or whether you're somebody coming towards the end of your life and needing to feel safe and loved and connected as you face the end of your life. And all of the agencies which affect human happiness must work together to affect that outcome, and that includes, of course, particularly educational institutions. Did you know, if you look at human happiness, the primary school that you attended is as important as your parental characteristics for your happiness and your prosperity in your 20s. So the influence of the schools we go to is enormous. So I think what stems from this is 4 leadership priorities that we have to address. I read a book last year. Actually, I read more than one, but it was an amazing book. It's by an American philosopher and feminist, Rebecca Solnit, and she proposes that hope is not based in some starry-eyed optimism. Hope comes from us taking collective action together. That's where hope is, taking collective action. And I think that there are 4 leadership priorities in education. The first is the importance of addressing the workforce crisis, and for reasons I'll explain, I think compassionate leadership has to be at the core of our response. Secondly, we have to address issues of equity and inclusion and valuing difference and diversity in our work organizations, in our communities, in our nations. Third, we have to address this issue of staff stress. And this is beyond, the provision of mindfulness apps or advice on diet and exercise. It goes much deeper than that. The reason that people get stressed at work is because we're failing to meet their basic core human needs. And we have to address how we better meet those needs. We can't go on like this, watching people's stress and burnout levels rise and people quitting. And fourth is, I think we have to harvest the knowledge and skills and motivation and experience of everybody who works in our educational institutions. We have one of the most skilled and most motivated workforces in the whole of industry in education. And we need to create the conditions where everybody's ideas and motivation and experience is brought to bear to help us find solutions to the most difficult challenges that we face. And that is most effectively mediated through the creation of teams, moving away from hierarchies more towards the creation of teams and ensuring we're creating effective team working and inter-team working in our organizations. We human beings have been working in teams for hundreds of thousands of years. We're actually pretty good at it, but we need to make sure that we're developing effective team working within our organizations. For me, working underground for a year as a labourer in Oakdale Colliery was a kind of awakening to see how important team working was. Everybody working underground had the same core focus. At heart was each other's safety, and it was the team you worked in which kept you safe. So we need to build team working effectively, both for releasing the innovation and creativity of those who work in our organizations, as well as to provide the support that we need. We know that for head teachers and leaders of any organization, what's critical to their effectiveness is the team around them. And how we create and nurture and develop that team is fundamental. So at the core of all of this is compassion. And let me explain what I mean by that kind of slightly nebulous term. So Paul Gilbert, who is, I think, the guru of compassion in the United Kingdom, clinical psychologist, defines it as a sensitivity to suffering in self and in others. So reflect on that. It's a sensitivity to suffering in self and others with a commitment to prevent or alleviate it. So it's more a motivation than an emotion. It's more a motivation. And you can think of it or you can conceptualize it as having 3 directions. And for each of us personally, there's the compassion that I show to others, and I can ask myself the question, how good am I at doing that? How effective am I? And then there's the compassion I receive from others. Am I afraid of that? The compassion, and then the compassion I show myself. Am I uncomfortable with that, afraid of that? And those three directions complement one another. More simply, if you like, we can understand compassion as having 4 behaviors associated with it. So what's your name? Bethan. So if Bethan here, if you're in pain or distress, then for me to be compassionate, I have to do 4 things. I have to attend, understand, empathize, and help. Those 4 behaviors. Attending, understanding, empathizing, and helping. And attending means, first and foremost, I have to be present with you. I have to be here and now with you. Not thinking, how can I be compassionate towards Bethan? Not thinking, oh, I wonder how long she's going to go on for because I've got a meeting to get to. Not thinking, oh, what just happened in that last meeting, but simply being present with you. And it's, I think, important to say that we don't have to try to be present with each other because we're always present. What we have to do is let go of all of the other stuff that gets in the way of us being present. Ruminating, being anxious about the future, just simply being present with the other person. And that enables us to give our cognitive attention, and our emotional attention. Nancy Klein has a wonderful phrase that captures this: listening with fascination. So being present with each other and listening with fascination is the basis of compassion. It's the most important element. And what that does is provides a powerful platform for the second element, which is my seeking to understand the causes of your pain or distress through us having a dialogue together, rather than me just imposing my understanding. And what that enables is me to empathize with you, to feel your pain or distress, but having the presence not to turn it into my drama. And we're all, 99% of us are hardwired exquisitely by evolution to be empathic. We have these billions of mirror neurons in our brains which help us to feel the other's emotions, good or bad. And feeling your pain or distress provides the motivation for the fourth element of compassion, which is the intention to help or serve you in some way. And we know from neuroscience studies that there's a profound difference between empathy alone and compassion with that additional intention to help component. So when we ask people to be empathic, that's associated with the activation of the relevant pain or fear centers in the brain, whatever it is. But when we ask people to be compassionate, that's associated with the activation of the reward center in the brain. A complete fundamental difference. Why? Because we've been hardwired by evolution to be compassionate to others or pain in distress. Again, I would say 99% of us. There is a 1% exception. Because this has huge evolutionary value. It's what enables us to connect with each other. And compassion is about blurring the boundaries between self and other. It establishes that feeling of connection, of trust, of belonging. And belonging is hugely important in human behavior, as you know. We're as likely to die from the effects of loneliness as we are from smoking 15 cigarettes a day. And it's deeply worrying currently to see across Europe increases in loneliness and people living alone in many communities and societies and countries. And we also know a lot more now about the role of compassion in human health generally. And I want to show you, I do a lot of work in healthcare organizations, as Owain has said, and I want to show you some results from the thousands of randomized controlled trials, the kind of gold standard of medical research and meta-analyses. The first is a randomized controlled trial of anaesthetists visiting patients prior to surgery, where in one arm of the intervention, they do a normal visit and provide sedatives. But in the other arm of the intervention, they don't provide sedatives, but they're briefed to be extra compassionate in how they interact and converse with patients. And that's associated with patients having a much lower requirement for painkillers post-surgery, and they have a significantly shorter length of hospital stay. And the second example is a famous large randomized controlled trial of patients with an early diagnosis of lung cancer, randomly assigned either to normal early cancer care or to normal early cancer care plus early palliative care. So if you like, an extra dose of compassion early on in their connection with healthcare. It was a study of quality of life, and not surprisingly, what the study found was that those patients who had the early palliative care intervention had a much better quality of life. But what was an unexpected finding was that they also lived significantly longer. And we see similar large effects of clinician compassion in the treatment of long-term disorders like HIV and diabetes, and of therapist compassion in the treatment of mental health problems. Not surprisingly, there are huge cost benefits, financial benefits associated with compassion because quality of care is better, there are fewer errors, there are fewer repeat admissions, fewer referrals for more investigations, etc., etc. But I think what's really profoundly important from this research is the finding also that in randomized controlled trials with GPs and nurses who are asked to be extra compassionate in their interactions with patients over a 2-week period, that's associated with a significant improvement in their own mental health, lower levels of anxiety, stress, and depression. So the point is, fundamental, that when I'm compassionate to somebody, it benefits them, but it also benefits me as well. We have no evidence of compassion fatigue. We have a lot of evidence of empathy fatigue. If we just simply empathize and empathize, but we're not able to help, that's what's corrosive and draining and exhausting. And we also have a lot of evidence of workload, stress and fatigue and burnout. So the number one factor, as you'll be aware, that predicts burnout and stress at work is chronic work overload. So I think the challenge for us, actually in all our organizations, but particularly in education, where we're concerned to create an environment where learners will feel safe, confident, connected, curious, eager, interested, where they feel a sense of challenge but also strong support. It's how do we create the conditions within our schools where staff will be even more compassionate to those they provide learning for, where they'll be even more compassionate to each other, and where they'll be even more self-compassionate. So those 3 directions. And the answer to that question is, well, that's about the culture of the organization. How do we shape the culture of our organizations? Every single interaction that every one of us has in our schools every day is an opportunity to shape the culture through how warm, kind, irritable, cynical, aggressive, compassionate, humorous we are. We know the emotional and behavioral ripples spread out. The evidence we have is there are 3 degrees at least of separation. So if Bethan is kind to me, I replicate that with subsequent interactions. They replicate that with subsequent interactions. They replicate that with subsequent interactions. We're talking exponential degrees of influence from our behaviors. But we also know from the last 100 years of research on organizational culture internationally that your role is the most important in terms of culture. The role of leaders in organizations is critical in shaping culture because what leaders pay attention to and focus on, what they measure, what they talk about, and particularly what they model in their own behavior, tells those we lead what it is we value. So if we're to create more compassionate cultures, then leaders have to model compassion in their leadership. And in practice, what that means is leaders having the courage to be present with those they lead, to listen with fascination. It takes courage, because often what we hear is people saying, I'm utterly overwhelmed with work. What are you going to do about it? I'm exhausted. I'm thinking of taking time off for stress. Leaders who have the courage to seek to understand the challenges that those they lead face, through having a dialogue with them, not through imposing an understanding from some elevated hierarchical position. Leaders who have the courage to empathize with those they lead, to feel what it's like to be a teacher working late into the night on tasks, having a young family of her own, feeling exhausted and recognizing that she has to get up early the next day and do it all again. And leaders who have the courage to help those they lead, the intention to help. And that means helping those we lead by helping them to be clear about what it is they're required to do, and by helping them to do their jobs more effectively, by helping to remove the obstacles that are getting in the way, and by helping to ensure that they have the resources they need to do their jobs effectively, the right numbers of staff, the right equipment that works, the right training, and so on. And we know from studies in every sector that these four behaviors are critical to effective leadership. Forget the words compassionate leadership. We've known for 60 or 70 years that these four behaviors are critical to effective leadership. It's gone quiet. What happened? The most important skill of a leader is listening to those we lead. And the most important task of a leader is helping those we lead to do their jobs more effectively. And we know, as I said, from studies across sectors, that these four behaviors are associated with the higher levels of staff engagement, higher levels of productivity, higher levels of innovation. And staff engagement proves to be absolutely critical to the performance of any organization. But you know what's fascinating is that kind of blanket term, staff engagement, what it hides is that the most important element of staff engagement that predicts the outcomes we seek, productivity, the Aston outcomes and so on, in healthcare, care quality, patient satisfaction, staff retention, is the extent to which staff are involved in decision making. That's absolutely critical to engagement. And the extent to which the organization and the leaders mirror the values of the staff that they lead. And the core value of most people working in education is a commitment to create the conditions for these young people, these children, to experience their world with a sense of wonder and curiosity and delight and eagerness, to feel safe, to feel loved, to feel connected. So to the extent that people see their leaders as mirroring those values, they're much more engaged, and if they're much more involved in decision making. In healthcare, where I do a lot of the work here in Wales and in England, back in England in 2003, we introduced for the first time a national staff survey that's run for 21 years. Over 650,000 people completed every year. It's the biggest, longest running staff survey in any sector in the world. And when we analyze the data over time, what it shows us is the more that people in an NHS organization report that their leaders behave in those four ways, in those organizations subsequently, what we see is higher levels of staff engagement, staff satisfaction, better care quality, patient satisfaction, fewer errors, less infection, and much lower levels of avoidable patient mortality. And those results mirror what we see in every other sector where we've done that research. So for all of these reasons, I think compassionate leadership has to be at the heart of our educational systems throughout every level of our organizations. But it's really important to say also that compassionate leadership is not some soft cushions, scented candles approach to leadership. On the contrary, it requires much more courage and authenticity to lead in this way than the rather easy opt-out, I think, of command and control. Compassion is about leaning into pain rather than avoiding it. Compassion is about leaning into conflict and difficulty rather than pulling away from it. So compassion is about having courage and wisdom at the same time. It's about having the courage to deal with difficult behaviors within our organizations, people who behave aggressively or always cynical or whose performance is really, really poor. It's about having the courage to deal with that rather than ignore it or hope it'll go away or hope, or just rely on people being promoted. I talked about 1% of people being an exception. We know that in the general population, narcissistic behaviors are characterized about 1% of the population. People who are likely to be bullies with those sorts of behavior, people like, for example, Donald Trump, an incredibly narcissistic behaviors that are displayed and bullying behaviors. 1% in the general population, 6% among senior leaders in organizations. They often rise to the top because their behaviors aren't challenged and people find an easy way out and they're confident and brash and abrasive, and people mistakenly think that is characterizes great leadership rather than the humility which we know is characteristic of great leadership. It's about having the courage to give negative feedback. Another factor that we know is associated with high levels of engagement amongst people at work and involvement in decision-making is working in an appreciative environment. People saying thank you, showing gratitude, recognizing contributions. We know also that leaders dramatically underestimate the effects of their saying thank you and showing gratitude to others. So I'm sure everybody in this room is really good at saying thank you and showing gratitude. But as long as we do it authentically and thoughtfully, we can do it 10 times more. It's so important. But it also creates the context where we can give the clear negative feedback that people want at work. People do want to get negative feedback from their leaders when it's helpful and appropriate. Excuse me, I heard how you just spoke to that parent. And I have to tell you, if that was me you'd spoken to in that way, I would feel really hurt and upset. Compassionate leadership is also about the courage to lean into conflicts, because disagreements, debates, and so on are hugely important to improving quality. Now, I always think that the best barometer of a team's functioning, if you want to know how well your team is functioning, it's the level of innovation, the extent to which the team is introducing new and improved ways of doing things, improving quality. Because if team working is effective, then people will be developing together ideas and implementing ideas for new and improved ways of doing things. And when you innovate, there's conflict and debate. So part of being an effective, compassionate leader is having the self-compassion to learn how to manage conflict effectively. I like this book. It's by Amy Gallo. It's a Harvard Business Review book. I like it because it's very thin and has got big writing, so I can get through it quite quickly. It's a really effective book. There are many in the area of dealing with conflict, but like all people exploring conflict, Amy Gallo distinguishes between task conflict and interpersonal conflict, or debates about the task. And there are 3 types. There's debate about what we should be doing, debate about how we should be doing it, and debate about who's responsible. And those are great debates to have. If we're not having those debates, we're not improving quality. If we're not having those debates, we're not improving quality. And then there are interpersonal conflicts. The debates about improving quality, by the way, if they're not managed well, they can spill over into interpersonal conflict. And part of our role as leaders is to be aware of when that may be happening, to make sure that people are having debates in an open, mutually respectful, kind of mutually valuing way. Chronic interpersonal conflict in our teams is a disaster. If you have one or more people who are, continually making others feel uncomfortable, that's a disaster for the whole team. I say to colleagues in healthcare, if you have people like that in your clinical team, that is as dangerous to patient care as medication errors and dirty equipment. So part of being compassionate as a leader is leaning in to manage those kinds of interpersonal conflicts wisely. It's also about creating the kind of conditions within our teams where the diversity of opinions and the diversity of approaches is valued, because that diversity is the stuff of innovation. We've been studying teams in a variety of sectors for 40 years now. And all of our research and others around the world has shown that the more diverse a team is, whether that's in terms of professional background or demographic background, if they have clear direction as a team and they meet regularly, that diversity is profoundly important in terms of facilitating, fertilizing innovation and creativity, and thereby productivity. So it's also about having the courage to manage the non-compassionate behaviors of those who lead us. So within the whole educational system, there may be people at Welsh Government level or possibly in Aston or wherever else in the local authority whose behaviour is not modelling compassion. And part of the courage of compassionate leadership is working collectively to provide feedback and to address those behaviours. Recently, the head of the health service in Wales, Judith Paget, wrote to every chief exec in the NHS and senior director to remind them of their responsibility to model compassion rather than aggression and unpleasantness. Because it's the whole culture that we need to address to transform our organizations. So, compassionate leadership is about those 4 behaviors, but it's also about being effective as a leader. And you know that you have effective leadership in a school or a team or a department when there is direction, alignment, and commitment. And what that means is this. Direction means that we have a clear shared vision of what we're here to do. And sometimes people think about the vision in organizations, just management speak. Actually, it's really important for connecting people with purpose, giving people a continual sense of meaning and purpose in the work that they do. We want to ensure that we create the conditions where every learner in this school maximizes their potential for having a happy, fulfilled life, feels safe, feels valued, feels respected, feels supported. So the vision and continually restating that vision and renewing it when necessary is vital for direction. But it also must be translated then into clear goals. So for your team, for the organization, your school as a whole, for every department or within your school, it's important that each team has translated their purpose into 5 or 6 clear, agreed, challenging goals. If there's one axiomatic finding from all of the research on team working around the world, it is that having agreed a limited number of clear, challenging goals is the key factor that determines team effectiveness. I find in the organizations that I have the privilege of working in that it is the most common factor, the absence of teams agreeing clear, challenging goals. 5 or 6, not 56. What I see in many organizations is there are so many priorities that nobody knows what's important anymore. There are so many key performance indicators and targets that no one knows what's important anymore. Yet, in those organizations and in those teams that have agreed 5 or 6 or 7 maximum clear, challenging goals, clear, not vague, challenging, not unambitious, that's what predicts team effectiveness and innovation. And it's vital for your team, because your team plays the critical role in your well-being and your effectiveness. And alignment then simply means ensuring that everybody's efforts are aligned around that purpose, not being wasted on unnecessary meetings or unnecessary bureaucracy or petty interdepartmental or interpersonal conflicts. And if leadership is not inclusive, then by definition it's not compassionate. And if it's not compassionate, by definition it's not inclusive. You know, everybody in this room, everyone in this room, as a leader, has people in their teams or in their schools who they get on with a little bit better than others, who they like a little bit better than others. And what we all tend to do is to spend more time with those people, and we attribute their success to their inherent capabilities. And those we don't feel so comfortable with or seem a bit different from us, we spend less time with them, and we attribute their success to the luck of the job they happen to be in. We create, in effect, in-groups and out-groups. We all do this. We create in-groups and out-groups, and the more we do that, the less effective we are as leaders. Compassionate leadership, inclusive leadership, means that we're attending, understanding, empathizing, and helping at least equally with everybody. And for those who may seem a bit more difficult or a bit different from us, different political views, different country of origin, it's about spending even more time attending, understanding, empathizing, and helping, so that we create inclusive communities where everybody is valued and respected and supported. And the more we do that as leaders, the more that permeates the entire culture. And it's about collective leadership, you know, moving away from what's been typical of many public services is hierarchical command and control leadership. We have the most skilled workforce in education. Why would we manage people through command and control? You know what we know about effective team working as well? The other axiomatic finding is that the more leaders empower their teams to make decisions, the more effective those teams are, and the more motivated team members are. So we think as leaders of teams very often in terms of our dyadic relationships with each team member. So we're trying to work with each team member to motivate them. What's far more effective is empowering the team as a whole to make decisions. That has much more effect on motivation in our teams overall than what we do individually in individual dyadic relations. Yeah, so it's about when somebody presents a problem in your team, it's not about you coming up with a solution, it's about helping the whole team to generate ideas for new and improved ways of doing things. Now, we must grasp the power of team working in our organizations more effectively. And it's about how we work across boundaries. Increasingly, schools are having to work with local authorities, with the justice system, with social care systems, with healthcare, and how we work across boundaries is critical to creating the conditions within our country where people can be as happy as they can be. So we have to learn to work across boundaries, or even within a secondary school, how different departments work together, how the teaching staff work with the administrative staff and the estate staff. And what we know is that compassionate leadership is about how we enable that to happen across boundaries, attending to those departments, organizations, understanding their challenges, putting ourselves in their shoes, and always asking the question, how can I help you? How can we help you? So together we deliver more effectively for learners and for our communities. So compassionate leadership is about being effective, inclusive, collective, and working across system boundaries. As I said, I'm doing a lot of work in healthcare in Wales with health Health Education and Improvement Wales, who've committed, as Owain was saying, to a 10-year strategy to develop compassionate leadership across the whole of health and social care, with these leadership principles that I've just described underpinning the concept of compassionate leadership. And HEIW have developed a huge range of resources to support this, with the support of Welsh Government, and that's all being rolled out across both healthcare and social care in Wales, and they're very keen to share the resources they've developed. They've developed a compassionate leadership training program which we can easily adapt for education, and there's a commitment that this will all be influencing the behaviour of every leader across Wales in health and social care by 2030. Last week, the Compassionate Leadership Pledge was launched at an event in the King's Fund, London, along with the Global Compassion Coalition, where organisations and teams are being encouraged to sign up to a pledge to model compassionate leadership. And any organisation in the education system can do the same. And there's a wealth of resources available when you sign up to that. I think half of the NHS trusts and boards in Wales have signed it, and the other half have committed to sign it. And as I said, Judith Paget, the Director General, is strongly supporting all of that. Not only that, but they're developing a whole range of resources around policies and procedures and practices in all areas of activity to support that, so that we transform the culture to create more compassionate cultures. And I think we can do the same across the whole of education. And I know that there are really exciting initiatives in Wales, in primary schools, working, for example, with Professor Frankie Emeritws at the University of Derby around creating compassionate whole schools in Wales, training for learners, training for teachers, training for parents, with extraordinary results. I'm part of something called, as I mentioned, the Global Compassion Coalition. We're at a time where there's a desperate need for compassion in the evolution of our species as we face existential threats of the destruction of Earth systems, of the destruction of biodiversity, weapons of mass destruction, more international wars. And we desperately need to nurture this fundamental emotional regulation system that we have as human beings. The compassion emotional regulation system, rather than the threat system that we have, or the resource acquisition system we have, which leads us to extract and exploit so disastrously. And the Global Compassion Coalition is seeking to develop compassion in all areas of human society, particularly in education. There's a special special interest group which has been developed in education, and many resources on the website which you can have access to for free. It was actually created 2 years ago and started recruiting members in June 2023. There are now over 130,000 members, with over half of them from the Global South, and many people from education who signed up. It's free to sign up and free to access the resources. How are you doing? Everyone okay? So I talked at the beginning about the problems of staff stress and burnout, and I've had the privilege in the healthcare sector of working on co-chairing 2 national inquiries into mental health and well-being of doctors, trainee doctors and nurses and midwives. And this comes to the heart of the conversation today about well-being of leaders. I hope from what I've said so far, you'll have understood the message that being compassionate as a leader, embodying compassionate leadership, profoundly benefits your health and well-being. It's a way of leading which is powerfully effective for those you lead and for yourself. What those national inquiries showed us was that and this is looking at results of research not just in healthcare but across sector, that the typical response to problems of staff stress and burnout in organisations, well, there are 3 typical responses, if you like: tertiary solutions, which focus on dealing with the resultant problems of stress and burnout, things like counselling services, employee assistance programs. And then there are secondary interventions, things like giving people advice on diet and exercise and yoga, making people more resilient in response to stress. And then there are what we call primary interventions, which focus on changing the workplace factors which are causing the stress in the first place. By far the most frequently employed, what do you think the most frequently employed approach is? Tertiary and secondary together. Much rarer are primary interventions. And yet the evidence is really clear that primary interventions are by far the most powerful in helping to reduce levels of staff stress. So, and I'm not criticizing the secondary and tertiary interventions. My PhD research here in Cardiff was on the psychology of meditation more years ago than you can imagine. But you know, for all my enthusiasm for that, giving people access to more mindfulness apps on its own is not solving the underlying problems. So we need to address the primary causes. And the primary causes, as I said at the beginning, are that we are failing to meet the basic core needs of you and your colleagues in the workplace. And we have three, if you like, core fundamental needs as human beings. And they must be met, all of them, all three must be met in the workplace for us to be well and intrinsically motivating. We have a need for autonomy and control. You know, those of you who study the literature on stress at work may be familiar with the demands control model. The more control we give people, the more influence they feel they have, the less there's burnout and stress. And the second need we have is to feel like we belong in our workplaces, that we're valued and respected and supported. And the third need we have is a need to feel like we're effective. We make a difference through what we do. You know, the moral distress we describe people at work is often when they're highly motivated to make a difference for learners, but don't feel that they have because they're so overwhelmed. And what we've been able to do is unpack that and say there are 8 areas in the workplace that are particularly important. The first is people need to have voice and influence. So they need to feel like their voices are heard. You need to feel like your voices are heard. And not just people, you know, saying, yeah, I've heard you, I've understood, and then letting it go when you're talking about levels of burnout and levels of stress for you and your staff. The most outstanding organizations that I work with in healthcare are those that have the courage to create mechanisms for that. In Nottingham University Hospitals has over 100 nurse councils that meet for 6 hours a month to review and discuss and to influence the policy of the organization as a whole, and many more examples. It's also about working in cultures and climates of justice and fairness. You know, when we feel we work in climates of fear and blame, that corrodes our sense of control. If I fear that things are going to go wrong and I'm going to be blamed, or I'm going to be in the press, or there are going to be national bodies which are eager to jump in and blame me, then that reduces the sense of control. Fear and blame must be replaced by cultures of justice and fairness and learning. An Iron Bevan Trust here, NHS board in South Wales, focused on the problem of avoidable staff harm because they had a large number of employee investigations. Something's gone wrong, a mistake has been made, we'll have an employee investigation. And they discovered when they investigated that people who went through those investigations were still exhibiting post-traumatic stress disorder symptoms at least 14 months after the investigations were over. And most of those investigations resulted no more than a verbal warning. So they've shifted the way they deal with them to dealing with them much earlier, much more informally, rather than simply jumping to HR processes. And they've reduced them by over 2/3 with huge benefits in terms of sickness absence and lower and big financial savings also. I could give other examples across the system. And it's about creating working conditions, all the little pebbles in the shoe which really irritate people, computers that don't work, equipment that doesn't work, things that just take so long to get sorted, that the pebbles in the shoe that undermine that feeling of control. That I'm sure you can think of them, you can identify them in your own work experience. And second is that need to belong, and building effective teams is the most critical mechanism. Your team, the team that you lead, is critical to your well-being. When you lead a team that has clear goals and meets regularly, and you don't have disruptive, difficult people creating a negative climate, your stress levels, the evidence shows us, are likely to be 50% lower than they otherwise would be. 50%. The team we work in, that leadership team, is critical to your effectiveness as a team leader and as a school leader. And also, as I said, it's about creating compassionate cultures within our organisations. And the more that all staff embody compassionate leadership, because all teachers are leaders, the more that climate or culture permeates the whole school. And the third area is the need to feel like we're effective, that we make a difference through our work. And as I said, the number one factor that prevents that is the problem of chronic work overload. It's the number one factor in burnout and stress at work. And I think that many leaders, many of us I'm sure in the room, are reluctant to talk about chronic work overload because we don't have the solutions. So we create our own kind of moral distress. Leaders who go home feeling bad because they know that those they lead are under so much pressure, and yet they don't feel they have the solutions that will help them to make a difference. But it's not the role of leaders necessarily to have solutions to problems. It is our role to bring collective attention to bear on the most difficult issues we face. And the solutions to these problems are to some extent located located in the collective wisdom of those we lead, encouraging our teams to talk about chronic work overload. What can we reduce or get rid of in our work? But also at the same time, this group of people in the room collectively can make a profound difference to decisions that are made at national level. The more that head teachers speak with one voice across the system in Wales to Welsh Government, the more likely it is that wise, effective change can be brought about. You know, what we know about influencing at that level is that if you seek to influence at that level on your own, as one head teacher, as a lone voice, you're likely to get chewed up and spat out. You know, we know that whistleblowers generally are damaged as a consequence. When you speak collectively, that has a profound influence, but you have to understand that from all of the research on what's called minority influence theory, all of that research shows that what's critical to that is you have to have a shared vision of what you want to achieve. As a group, you have to articulate 4 or 5 clear messages in relation to chronic work overload. And then you have to repeat those messages to those organizations again and again and again and again. Once doesn't work. Twice doesn't work. It's the shared vision, the shared messages, and the persistent repetition which brings about social change. You think about how the Greens and the feminists have transformed attitudes in society over the last 40 years. It's through that shared vision and repetition and working together. So the last thing I want to say that I think is really important in terms of your well-being and effectiveness, and I've mentioned it a lot already, so I'm not going to dwell on it for too long, but is the importance of team working and how you create effective team working within your schools. And there are 4 levels of compassionate team working. One is encouraging within your teams self-compassion, which I'll explain in a moment. It's kind of overtly talking about and encouraging everybody to be self-compassionate. It's encouraging good relationships between those in your teams. But it's also thinking about the team as a whole, as I mentioned earlier. How can we empower the team? How can we ensure that the team feels safe as a team? And there's a lot of talk about psychological safety in our teams. And it's defined as the absence of threat, so we can have a conversation in a team meeting and people don't feel afraid that what they say will be ridiculed or criticized in aggressive ways. But feeling safe in a team is more than just the absence of threat. It's also the positive, caring, nurturing, valuing we feel from each other. So it's not just about the absence of threat. And then it's how we work across boundaries compassionately, as I said earlier. And I hope, Nia, if you're still here, everyone will have a copy of the slides. Yeah. It's also about how we model compassionate behaviours in our teams. And again, you can share these ideas with the members of your team, and you can sit together and review them. To what extent do we listen to each other? Are we present and calm in the face of the suffering of our colleagues without having to jump in and find magic solutions? Are we prepared to be curious when there are errors or problems of performance? Maybe there's something underlying that, rather than just treating it as face value. Do we have the courage to challenge policies and behaviours at national level, oriented to blame and punishment rather than learning? Children learn. I've have the gift in the last 3 years of 5 grandchildren, two aged 3 and 3 aged 1. I spend every Tuesday with a 3-year-old and 1-year-old. And by the end of the day, I'm bloody exhausted. But it is wonderful, and it is incredibly educational and incredibly nurturing. And they learn when they feel safe. They explore when they feel safe. So there's something about our national policies and procedures enabling people to feel safe and learn. So are we challenging policies and procedures oriented to blame? And do we have the courage to challenge toxic behaviours and toxic politics within our schools and national organisations? Over the last 40 years, as I said, we've looked at thousands of teams in schools, in healthcare, in manufacturing industry, finance sector, oil and gas, and we've been able to identify what are the key elements of high-performing teams. And I'm not going to go through all of this because it'll be familiar to you, I'm sure. The key dimensions are illustrated there. For example, do we have regular, effective meetings where we communicate well and make good decisions? And when I mean regular, effective meetings, I mean, do we have meetings people come out of saying, oh, that was really useful, that was helpful, as opposed to sitting through meetings and people looking down at the desk and just thinking, I hope death comes soon. We have so many videotapes of meetings that people just are clearly suffering. When we bring people together in a group, like this group of people, when we bring people together in a group, it's incredibly valuable time. It should be engaging. It should be fun. People should come away from it and feeling enriched. We should review at the end of every meeting. We should take at least 5 or 10 minutes just to review. How did that go? Was it useful? Was it valuable? How could we improve it? Did we need to have it? Did everyone need to be here? Did it need to be an hour? We should be, this is such valuable time. We should be making absolutely the best use of it. If you take the questions on the right-hand side and sit down with your team in the next 2 weeks and just ask the team to talk through their answers to those questions, we know from our research with thousands of teams that your team working will dramatically improve. You'll have the slides. You can do that. You can sit with your team. Do it again in another 6 months. Your team working will improve on every dimension. As a regular exercise, you don't need expensive surveys or external consultants. This will make a profound difference to your team working and will continue to. So as I said, it's about creating psychological safety in teams. It's about safeness, not just safety. This is an aid memoir for you. I'm not going to go through it. These are some of the key points I've made today. But I want to finish by saying that fundamental to all of this is your ability as a leader, your courage as a leader to be self-compassionate. What's your reaction that you pull away? Oh, no. I'm a head teacher. I don't need to be self-compassionate. But your ability to be self-compassionate, we know, has a huge impact on the compassion that you show those you lead and that they show those they provide support for amongst their colleagues and amongst the learners in your school. And very briefly, self-compassion can be articulated at 3 levels. The first level it's worth sharing with you, this is based on the work of Professor Sabine Sonnentag at the University of Mannheim, who's been studying recovery from stressful work for 25 years. We know that we recover from stressful work when we engage in activities that enable us to detach. Watching a Netflix series, having a meal with friends. When we engage in activities that challenge us, cooking a new meal. I'm learning French on Duolingo at the moment. Très mal, very badly. Activities that give us some control outside work, so not just another long list of tasks. We know that taking proper work breaks is important, not only for recovery, but for good decision making. So having a proper lunch break is important for recovery and therefore cognitive functioning. And we know that spending time in nature now is hugely important for our recovery. And there's a hierarchy of effects, with blue spaces, the most powerful recovery, being by the lakes or rivers or the sea over here in Penarth or wherever, closely followed by green spaces, the hills, the trees, then urban green spaces, but even being outside at all. And the more biodiverse a space we're in, the more we recover. It's kind of beautiful, mysterious finding. The more trees, birds, flowers, insects, butterflies, animals there are around us, the more we recover. Intriguing to wonder why. And the people who most need to engage in these activities are least likely to do so. The second level, if you like, of conceptualizing self-compassion is about putting into practice what we know about the ways to human well-being. By far the most important is spending good quality time with the people we love and who love us. By far the most important, and the others will be mostly familiar to you. Exercise, being present, continuing to learn and grow, getting 8 hours sleep a night. For 99% of people, 8 to 9 hours is the requisite amount. On average, we're taking 7, and you can't cheat nature. It damages our health, it damages our cognitive function, it damages our emotional well-being. And helping other people is critical. And the deepest level of self-compassion is having the courage to be present with ourselves. To be present with ourselves. So that I know when I'm feeling bad, upset, overwhelmed, angry, irritable, hurt. And having the courage to accept those feelings rather than push them away. Oh, I'm an adult, I'm a head teacher, I shouldn't be feeling like this. We disengage from ourselves, which makes it harder to engage with others. And when we accept that we're feeling bad, we then have the opportunity to inquire, why am I feeling like this? And then what can I do about it? What am I feeling? What do I need? How can I get that need met? The questions from the Stanford Compassion Cultivation Training Program. What am I feeling? What do I need? How can I get that need met? And then turning a nurturing, compassionate orientation to ourselves, as you would do for a member of your family or a dear friend who was upset or suffering in some way. You would want to help them, you'd want to comfort them, you want to nurture them. But why wouldn't we do that for ourselves? Each of us is as deserving of love as every other human being on the planet. And I'm not talking about some narcissistic self-indulgence here. I'm talking about the healthy orientation of self-compassion. And when we have the courage to connect more deeply and authentically with ourselves, we know that that has an impact in enabling us to connect more deeply and authentically and courageously with all of those we lead, all of those we serve in our educational institutions, indeed, actually all of those we interact with in our life. This is not just simply some leadership skill, it's a life skill, it's a way of being. So all of this begins with having the courage to be self-compassionate. So, diolch yn fawr iawn.